Hello everyone, my name is Anne-Marie Gray and I'm Professor of Social Policy at Ulster University, and I'm also the subject lead for the group of subjects which includes health and social care. So I'm really delighted to have this opportunity today to talk to you about the course and to answer any questions that you might have. So I'm just going to go through quite a short presentation because I think I want to definitely allow some time to answer your questions or respond to any queries you have. Just also to say that there will be a Q&A session. You can type in any queries you have as you go along, whether they're related to the content of the course, to the structure of the course, or to applications and admissions generally. And we'll certainly respond to you on all of those issues. So if I could just start by saying that one of our main aims in social policy, and certainly in health and social care policy, is to equip you as students to analyse current and future challenges in health and social care. These are global challenges, challenges which aren't unique to the UK or to Northern Ireland. Within social policy, our provision is grouped around a number of discipline areas. Health and social care policy is one of those, but we've also got degrees in social policy with criminology, and in social policy with sociology. But today our focus is going to be health and social care policy. So just to say at the outset that it's a policy degree. It is health and social care policy. If your area of interest is vocational health and social care and that you want to be a nurse or an occupational therapist or so on, then this probably isn't the course for you. But if you're interested in assessing and analysing and improving health and social care, then that means that it probably is. It's really something you should think about. Within our course, our focus is primarily on contemporary issues in health and social care policies and in the political, social and economic factors which impact on those policies and on their outcomes. So how they impact on different individuals or different groups of people differently. I just wanted to say something before getting into the content of the course about our mission in social policy. As a group of staff, we're very research active. Our aim is to influence social, economic and public policy. And we try to work with students so that they leave the university and they're really excited and passionate about the subject that they've been studying. And that becomes your aim also then, that you want to make a difference. So we're really committed to educating future leaders in social and health policy, to have our graduating students going out there and making change. So we aim to inspire you, to guide you, to address all of these really critical issues in society in terms of inequalities in health, health equity, how people access provision, not just in healthcare, but in social care, the factors which have such an enormous impact on our health. So the earnings we have, whether we live in poverty or not, the impact of global influences on societies, how the governance and delivery of our health and social care system can be improved. We want to change all of these things. And we do this as academics by carrying out high quality research which informs and shapes our teaching so that you're studying issues at the cutting edge of social policy. You're reading the most up-to-date research, the most critical literature. And we also inform our teaching through our work with governments in Northern Ireland, at Westminster, in the Dáil Éireann. Internationally, many of our colleagues work with the European Union, work internationally with the UN Convention treaty bodies, with voluntary organisations, extensively in Northern Ireland, with the civil service and with the media. So we're a very, very active and committed group of staff. So what is health and social care policy? So if you become a student of health and social care policy, what will you be doing? Well, you'll learn a lot about the development of health systems regionally, so here in Northern Ireland, nationally, in the UK, in Ireland, and globally. So what are these global influences that impact on how we do things in terms of health and social care? And of course, recently now, everybody's become much more aware of the work of global institutions such as the World Health Organization and the role that they play. We look at the key determinants of health and how services are accessed and experienced differently by certain groups. You'll know just from observing the world around you that very often when we talk about healthcare, we're talking about buildings, hospitals, health centres. We're talking about staff, doctors, nurses, carers. But actually, most of the things that determine our health don't relate to those things. They relate to how we've grown up, the diets we've eaten, the education we've had, the houses we've lived in, and the jobs we do. All of those things have an enormous impact on our health. So those key determinants are really important. You'll examine current challenges within health and social care, and certainly COVID-19 will now be one of those challenges. And we'll be looking at what is the future of health and social care in a very fast changing and dynamic environment. So of course, health and social care is very much in the spotlight. And what has the COVID-19 pandemic highlighted about health and social care provision? You know, of course, in recent weeks, the public has become more aware and informed about health and social care services as a result of the pandemic. Globally, healthcare systems have had to respond really quickly to sudden and unpredicted pressures. And the general public has been more exposed to some of the decisions that have had to be made, including ethical decisions in some countries about who should be placed on ventilators and who shouldn't. But actually, many of the issues that are now in the media have been long-standing challenges for health and social care. My own area of research is social care, and we've been talking as researchers for a number of years about the impending crisis in health and social care to do with funding, to do with problems with workforce retention, and so on. But these problems have certainly been very much to the media fore in recent weeks, and are all issues that you will be looking at as students. Within the UK, of course, the NHS, as you can see here, has always had tremendous public support. This slide is just an image from the 70th anniversary a couple of years ago. And there's a lot of public affection in the UK, always has been, for the idea of a nationally publicly provided health service. Even when the health service was introduced in 1948, one of the key things that, you know, that really brought people around to thinking this was a really good thing was how it was sold to the general public, not as a charity, but as something that people all pay for, something they contribute to as taxpayers. The reason why this was so important in 1948 was because, of course, prior to that, if you wanted to see a doctor, you either had to pay for it or you had to rely on a charity giving you the money to do that or providing your care free. That's not the case in the UK now with the National Health Service. Healthcare is free at the point of deliveries. But in many countries do have a public healthcare system, but some don't. And I think for me, one of the most distressing things was reading a report from one of the field hospitals in New York, where the consultant said that he had just left a patient that he had to put on a ventilator. And his last question was, who is going to pay for this? Because the United States does not have a publicly funded system. Despite the fact that the health service holds that public affection, there is no doubt that it has been coming under quite serious stress in recent years, and there are challenges in the UK, but also in many other European and international systems. Almost everywhere in the world, demand outstrips funding. That's because of changing demographics. People are living longer. People are kept alive at birth now. So very premature children are kept alive because of technology. And in some countries, there has been quite considerable underinvestment in healthcare. There are equality and equity issues which have plagued health services from their inception. So here in Northern Ireland, for example, inequalities in health is a major issue, as you'll see later in one of the examples that I use. There are challenges around standards and regulation. Some of you may be familiar with the issues relating to Muckamore Abbey and abuse there, but also in institutions across the UK. Some people are concerned about governance, about accountability, about how health service decision makers can be held more to account. There's an issue of how care is delivered. In the UK, the system is publicly funded. Health service is largely delivered by the public sector, but that's not the case for social care, where private providers provide much more care than the state. And there's all of those debates about how appropriate that is. And then, of course, there's the crisis in social care. And social care started at the same time as the NHS, but has never really been celebrated in the same way. Historically, it's a Cinderella service, separate from the NHS in its structures and its funding. 70 years really of underinvestment and many issues regarding quality of care and retaining an appropriately qualified workforce and paying those workers. This slide is just to give you an example really of, if we don't do anything, what that social care funding gap will look like by about 2030. So you can see that the red line shows the adult social care pressures. The blue line below is if we keep on funding social care at the current level, and you can see that there's a really significant gap there. So social care is certainly one of the most critical issues that we have to deal with. A question for you, something you might want to think about if you were a student of health or social care, and this is an assignment that we give our students to do. What would you change out of all of these challenges? What would be the one thing that you would prioritize? Maybe you would want to end hunger. We know that inadequate diets is a source of many major health problems, yet in the UK and in other European countries, we've seen much greater reliance in recent years on food banks, something that probably 20 or 30 years ago would have been quite unthinkable. And that's a map in the UK of how many food packages were delivered in just 1 year. Maybe you would want to address this issue, that how long you live actually depends on where you live. Maybe that's something you'd want to change. Across the UK, on average, if you're a boy born in one of the more affluent, well-off areas, you will outlive one born in the poorest areas of the UK by almost 11 years. And if you're a girl, that differential is 8.4 years. That's quite a stark statistic. And what does the social policy research tell us about that? Well, it tells us that the poor are dying younger because they have less money in order to live a healthy life. They have more pressures on them, they have more insecurity, and they have less control over their life. It's an example just of how much of your health outcome doesn't depend on the health services you have around you, but on those other key determinants. Or maybe you would actually be the person who would want to address that £2 billion funding gap in adult social care. The problems created by that include unmet need. People who need services don't get them because there's insufficient money. Social care staff, as we're all aware of now, are really poorly paid. And all of those issues ultimately lead to people receiving inappropriate care. And as this charity said in 2018, in the worst cases, that amounts to neglect. And that's at the hand of a care system that's meant to provide a safety net for people, but which often lacks the resources to do so. That's the idea of adult social care being a Cinderella service. So lots, I think you'll agree, lots to engage with there. I look forward maybe to some of your questions on these issues. Just to say something about our degree structure, it's full-time. If you study full-time, it's 3 years. If you study part-time, then it's about 5 years. And there's 2 semesters per year and 3 modules, 3 topics, if you like, per semester. In a course like ours, there's a lot of independent study. If you're coming straight from school, you might find that a bit odd at the start, but we certainly help you to make that transition. So if you think about every module or every topic requires 200 effort hours, then 164 of those will be about you working on your own or with your peers, with other people in your class. And then your coursework is submitted throughout each semester. Some modules or topics are examined just by assignments. Some have exams. If you do have exams to do, those are done in January and May of each year. This is just a sample, really, of some of the modules that you will study. So you see there things that you would expect to see on a health and social care policy course. So there's a module on contemporary issues in health. There's a module on adult social care. There's a module on disability, on policies for family and children. But the other modules are really actually critical as well. So it's really important that you study research methods. You need to know how to do research, how to understand research in order to evaluate policy, to really be able to critically weigh up what works and what doesn't. You need to know about race and migration issues, because ethnic minorities, for example, experience some of the worst health outcomes in many countries. You need to know about the experience that migration itself can have on people's health. And at the very bottom there, you'll see reference to poverty and social security. And that's at the heart, really, of determinants of health. So what happens in terms of what we do in terms of social security benefits, in terms of benefits for disabled people, has an absolute bearing on the health outcomes for those people. And the thing that helps us, whatever subject we study, to really try and work out why things are the way they are or how they can be different, is that we need to have an understanding of theories, of concepts. So what do we mean by care? What do we mean by health, actually? What are the issues if it's the state that's providing services or if it's other sectors? So theories of human need and so on will help us to understand all of those issues. As a graduate leaving our programme, I think there's a key set of knowledge and skills that we would like you to have because they're important for your employability, regardless of where you go to work. So we want our graduates to have a sound and a really critical understanding of policy, how policies are made, how they can be influenced, how they can be assessed and evaluated, and of theory. And that is building on concepts such as human need, the needs that we all share as humans, or the different needs that we might have as individuals or as groups, how we can share risk in our society, and what do we mean by citizenship, and how does citizenship relate to health and social care. We like our graduates to be independent and critical thinkers, not afraid to challenge, not afraid to say that things have to change. To do that, we need you to be able to analyse policy and to be able to not just say what's wrong, but how things can be improved. So how do we go about developing recommendations for long-term strategic solutions? So within our modules, there is a lot of problem-solving activities. Our graduates leave with excellent research skills in quantitative methods, the analysis of statistics, how you do statistical research, how you read statistical research, and also in qualitative research. So a lot of issues in health and social care, we need feedback from people about their experience of services. And that requires talking to them, doing interviews and so on. And all our students gain some practical experience. There is a compulsory 6-week placement at the end of year 2. Say something about that in a moment or two. But we also encourage students to do voluntary work if they can, and to build up their skills in that way. We're very fortunate within our school that we have one of Northern Ireland's leading research centres, which is ARC, Access, Research and Knowledge. And as a student of social policy and health and social care policy, you will benefit from the work of our research centre. Every year we carry out major attitudinal surveys, the Northern Life and Times survey, the Young Life and Times survey, which is an annual survey of 16-year-olds. Some of you may have completed it. And the Kids Life and Times survey, which is an annual survey of 11-year-olds. But in addition to the surveys, we do a lot of other critical policy work. And ARC is really Northern Ireland's social policy hub. We make information accessible and free of charge to students, journalists, the general public, policymakers. So we support civic society, and in doing so, we try and engage people in debate and challenge social policy. And we have a very, very wide range of online resources, podcasts, videos, research updates and so on, which you will benefit from as a student. This slide just gives you an example of some of our placement opportunities and where people have gone in the past. So we have people each year who go to Health and Social Care Trusts, to the Regulation and Quality Improvement Authority, which inspects and regulates hospital provision in Northern Ireland, children's homes and residential care facilities for adults. Nearly every year we have people who go to the Northern Ireland Assembly and Research Service. So what they do is they provide evidence, do research for policies. They use academic research in their job, but also research from other sources. And they do work for MLAs and for civil servants. Bernardo's is one of the leading voluntary organisations in Northern Ireland, as are NSPCC, AGNI as well. And again, these are just examples of the voluntary organisations that our students would be placed in. Local councils also have health responsibilities. They have a duty to promote the health of the public in Northern Ireland, and they have wellbeing responsibilities. So they're also a good place to go. And then the two statutory commissioners, the Commissioner for Children and Young People and the Commissioner for Older People, their offices have also been very good at taking our students. And I can't really overemphasize the extent to which we see students benefiting from placements, even in that short 6-week period. There's plenty of opportunity to get to know how an organisation works, to get plenty of practical experience, and to network with other agencies as well as part of that. Just want to end by saying why we believe that health and social care policy is important. It's important because it touches all of our lives in different ways. There's not a single one of us who hasn't been exposed to health policy, certainly. And many of you will have relatives who have had to use the social care system. And at the core of social policy, at the core of the discipline, is a fundamental concern for human and social well-being. So social policy, I see, and health and social care policy is a very positive subject, that it is about enhancing the quality of people's lives. So how we choose to structure our society, to organise it, affects not just individual well-being, but collective well-being, societal well-being. And without effective social policies, quality of our lives would be significantly reduced. So as a social policy student, what you'll be doing is learning to offer complex solutions to complex problems. I know that quite often people say policies are too complex, they should be more simpler and so on. And often that's not a good thing, because problems are complex. The solutions to them therefore have to be, but as a very good student, you would be learning and getting practice in discussing those issues in a way that lay people and the public can understand. So thank you very much, and I look forward to any questions you have.
That's super, Anne-Marie. Thanks very much for that. It was a great overview of everything. Just there's nothing coming in there yet, but just I'll take this opportunity just to make students aware. Obviously, there's a series of webinars taking place, so keep an eye on the website. We're hopefully have a few more weeks left yet, and we'll be advertising and promoting across the whole of the university a wide range of courses. So do log on there, and hopefully you'll find something that's of interest to you. Also, concerning open days, again, those traditionally would have been held in the first couple of weeks in September. Just as yet, we haven't confirmed a date or how that's actually going to take place. Sorry, whether it's going to be, you'll be able to visit the campus or it's going to be done virtually. But again, do keep an eye out for that on the website. And the guys in Anne-Marie's team and the department, Health and Social Care Policy, they'll all be taking part in those open days and those different events. So again, it'll give you the opportunity to engage with her and her team, and again, find out about the courses in a wee bit more detail. So yeah, so nothing's just coming through there yet in terms of questions. We can just give it a few minutes, but nothing there yet. But thanks very much for that. It was really informative, and definitely give us all a good background in the whole area and the course and the opportunities that exist for students afterwards as well.
Yeah, I mean, and we are very happy, Michael, for people to get in touch with us directly.
Yeah.
Very happy if people want to email me, or we can have a Zoom call or something if they've got something they'd like to discuss on a one-to-one basis.
Super.